My presentation is going to tackle the question, what's the benefits of grafting the osteotomy site upon placement of an implant immediately. I know I'm knocking on old doors. It's an old problem. It's been tackled a lot before. But why not? I mean, every now and then, a new technology, an old problem, and one big idea turn into an innovation. Why are we all here today is because we all want successful osseointegration, a predictable one. We need to have a successful implant treatment over time, assessed by success criteria like those ones proposed by Dr. Albertson at 1986 or by Dr. Professor Boozer 1990. One of the most important factors to have a predictable osseointegration is to realize when to place the implant. The protocols of the timing of placing an implant post-extractions have been perfectly stated by the ITI 2003 and 2008 consensus forms. And they are divided into 4 categories: immediate implant placement, which basically logically happens on the same day of extraction. The advantages of such approach is it's only one surgery for the patient. The placement of an implant immediately would allow us to do an immediate loading protocol and an immediate provisional for the patient. But the negatives and the disadvantages of such approach were discussed thoroughly, and it's a very complex procedure to get enough primary stability and to place an implant in the right place. And of course, we do not predict the bone remodeling after.